Oh, add this to your acronyms. One more. You like the collar and all that? It's MRSA.
Is it a virus?
So do you know what MRSA is? You know what it stands for? Alright, so MRSA is methicillin resistant Staphylococcus. And Staphylococcus is STAPHLOCOCUS, something like that. It's staph infection.
Yeah.
Staphylococcus aureus. So staph infections, staph is everywhere.
Yeah.
Bacteria, Staphylococcus aureus is everywhere. So we get a cut on the skin. If it gets infected, it's usually a staph infection. Staph infection is no big deal. Alright, we probably get them. We don't even know. We don't even think about it. You get a cut or something, you get a cut and it gets swollen on it, it's just a staph infection. Now, staph infections are dangerous to anybody with a lower immune system. But MRSA is like super staph. So it's staph that's resistant. What is it resistant to? Methicillin. So it's you have to take basically big time antibiotics to beat staph. So it's basically staph that is resistant to a lot of antibiotics. So you gotta give stronger antibiotics. That's it. People that, if you say MRSA, it's highly contagious. So it's like C. diff. Have you ever heard of C. diff? Clostridium difficile. You know what that is? It's where your good gut bacteria is cleaned out, and you don't have good gut bacteria. And basically, anytime you wipe or anything, it's like you touch stuff or whatever, you can get people exposed to it. But you're shitting all the time, and you're having abdominal pain and stuff like that. But MRSA and C. diff will shut down wings of nursing homes. Super staph, and it's just the easy way to super staph, and like you have to do all your PPE for C. diff. Believe it or not, you know what the cure for C. diff is?
Poop.
Poop transplant.
Uh-huh.
Yeah. So, all right. Has anybody ever taken antibiotics before?
Yeah.
Please raise your hand. Okay. All right. So if you take antibiotics, have you ever gotten abdominal pain from it, or diarrhea?
Yeah.
So do you know because what antibiotics do? They're harsh on your gut, and they take away your good gut bacteria. So people who are on chronic antibiotics are really at risk for C. diff.
Mm-hmm.
Do you know what the fix is?
Yes.
You take a probiotic with it. Take yogurt. If you take an antibiotic, next time you take an antibiotic, they say to eat beforehand. Take yogurt. And take a probiotic
They
with
also
it.
give females a yeast infection.
Yeah. And
Usually they like sometimes if they give like females.
what else does it do to females?
You do. Days.
What does it make ineffective?
Oh, birth control.
Yeah.
Oh, I didn't know
Didn't know that.
Okay.
So next time you take antibiotics, nobody out there.
I was like, oops.
I appreciate that.
Don't be all active when you take your antibiotic. It makes your birth control ineffective. Yes, it can give you a yeast infection. And then, by the way, if you take inhaled steroids, it can give you thrush.
Yeah.
That's why I always say wash your mouth out real good when you're doing like Symbicort or anything, like inhaled steroids. But antibiotics are not great for your body, but you have to take them. Take a yogurt, or even like the Danimals probiotics, or
They sell like
the
probiotics.
green one. I can't remember who makes that. The
Activia.
Activia. They make those. Just down it. I lost 10 pounds due to diarrhea taking an antibiotic from a dog bite that I thought was going to be literally right here on John Arden. Saw a dog get hit. Thought it was going to be
Super.
real nice guy and everything, and his last little thing before he went unconscious was he bit the shit out of my hand. Little 15-pound dog. I didn't know you're supposed to cover them with a blanket when they're injured.
Yes.
So you handle them. And I was like, okay. And then I had to sit there and watch him euthanize him. And I was like, okay. I was like, you just killed that dog. I thought the car did it, but you did it. Anyhow, but I was having bad abdominal cramps, diarrhea. I was like, oh, like that. And the doctor goes, what's wrong? I was like, I just feel like shit. This antibiotic is just tearing up my gut. And they go, oh, like, take yogurt with it. I was like, what? Hey, yeah, take yogurt or probiotic with it. It's taking away all your good gut bacteria. I was like, okay. Did that, never had a problem since. Told my mom about it. She was having problems with antibiotics. And I said, oh, just take some yogurt and stuff. And she was like on her third day of it. She had to take, was it 7 to 14 days of antibiotic? And she goes, yeah, I never had a problem since. I tell everybody about it. But you get C. diff, highly contagious, and you need a poop transplant. There's actually a place in Dallas that'll pay you to go take shits.
They'll pay?
Yeah.
What's the place called?
Uh,
Just kidding.
the poop transplant center of Dallas. I don't know.
I thought, how much, I thought that was a South Park episode.
It is,
I
man.
bet
It is
a South Park
true.
episode.
It is.
They don't do that, and then but MRSA is just super staph, and it's highly contagious, so they'll shut down lines and stuff. Anything that's contagious, they'll always try to isolate and stuff like that. So, bloodborne and airborne pathogens. Hey, what are your bloodborne pathogens?
Hepatitis.
Hepatitis what?
See?
So I'll give you your. I'll go ahead and give you your heps.
Yes.
Hep A, B, C, D, and they like to ask you this stuff. All right. So 2 of these are fecal oral transmission. A and E. Just remember, ass and entrance. I would say ass to mouth, but we don't have a hepatitis M. But yes, going ass to mouth, you can get, it's fecal oral transmission. So they had a breakout of Hep A at Luby's. They used to have a Luby's up there in DeSoto. Lady had hepatitis A.
Still
back
there.
before, this is years ago, back before you had to wear the gloves and all that other stuff. She's going to the bathroom, not really washing her hands and stuff like that, and she gave a bunch of people hepatitis A. So ass to entrance. So people were eating, getting a little fecal dusting on top of their food whenever she handled it, and you get an A and E breakout. Now, these are your bloodborne transmissions, B, C, and D. What they love to ask about this is, what are you most protected from? B and D. Because you get a what series? Hep B series. It's a vaccination. And you can't get Hep D without getting Hep B. So your Hep B vaccination actually prevents you from getting Hep B or D. So if they ask National Registry, they ask that. So what are you most protected from? It's Hep B because we have a vaccination for that. Now, so really, your only hepatitis, well, you know, B, C, and D are your bloodborne, but the one we concentrate on is Hep C. So your bloodborne pathogens that you need to worry about is Hep C, because it's bloodborne and bodily fluid. HIV, hemorrhagic fever. You know what the other name for that is? What did we have a breakout of about years ago?
COVID.
Dallas.
Ebola.
Ebola. Hemorrhagic fever is Ebola.
My dad got hepatitis C from a monkey in Africa.
Serious?
He got bit
Your dad's just
worse
going
than
through
what?
it.
He got bit by a baboon in Africa, and then it's overseas, and he got hepatitis C.
Hey, you got monkeys running around biting folks out there?
Oh yeah.
Right, you get this. Right, I get Parma syndrome too. Probably always started with the monkey.
Maybe. I don't know.
Right. This is born under a bad sign.
He was gonna do 30 years in the Navy, but Jack got him off at 23.
Really?
Yeah.
Is that what he's doing? He's over there with the Navy?
Yeah.
Do by damn one.
You know, the engines for,
Holy shit.
yeah, he just got promoted to 06 too.
Really?
The engine. A monkey.
Well, yeah, a baboon took it down.
Yeah.
Alright, so, what do we say? Hemorrhagic fever, Hep C, HIV.
What are the monkeys doing with that seed though?
Probably got a lot more than that.
Monkeys are,
So,
That'd be screaming.
I'm sorry, repeat one more time. Hemorrhagic fever, Hep C,
and HIV.
and HIV.
Oh, your H's. Now, tell me this. Which one do you need, let's say, which one do you not need to worry about as much?
B and D.
Nope.
HIV.
HIV, why?
Because it's like a 1 in 10,000 chance of getting it.
Because as soon as it hits the air, it's dead. So, if I put some blood here, HIV's not the one you need to worry about. If I left some blood here on the ground, and I rolled around in it, guess what? I'm probably not gonna get HIV. Now, I could leave some blood here from a Hep C patient, leave for 2 weeks, come back, roll around on it, I just got exposed to Hep C. Hep C does not like to die. So Hep C is the one you need to worry about. Alright? So, I tell you that because there's not a lot of blood-borne bodily fluids that you have to worry about. Everything else is airborne transmission, airborne droplet. TB, airborne droplet. Meningitis, airborne droplet. Measles, mumps, rubella, all that shit is airborne. Alright? So, the thing you got worried about is, so how do we protect ourselves against airborne
N95.
N95? Do we put it on us or the patient?
Both if you want to be safe.
Put it on us. Us first, because we're number one, partners number two, patients three, bystanders are four.
I said that the other day to one of my fire guys, and I was like, me, we, them, right?
Yeah.
Something that's been taught forever. And he was like, that's stupid, like, he said,
If you become a patient, you can't help anybody.
that's what I was saying. He said, I signed up to die in this show. I said,
Oh. You better get away
Back
from
to
that.
the suicide deal.
Yup.
Yeah.
So I don't want your wife and
Yeah.
You're stupid.
Yeah. Very idiotic.
Yup with that.
Alright, so, airborne droplet, N95. On you. The big one's TB, they like to ask you about that. Alright, what you got?
I was gonna say my dad had.
Oh my God.
No, my dad, he told me, I asked him, I was like, what did the monkey bite you with? Well, no, what did you get from the monkey? Because I know it's some sort of hepatitis, and he said he had it for 16 years.
But you don't know what letter it was.
It was C.
Oh, okay.
But he had hepatitis C for 16 years.
So they have actually hepatitis C treatment now.
Yeah, but back then, they didn't know.
So they had treatment to minimize the symptoms, but they actually found, I think they found a cure.
It makes it inactive.
Yeah, but you cannot, I think the deal is you can't have any previous, they have like a cure that you can't have any previous treatment, like to make it inactive. Like, it has to be like new onset, like first onset. And I think they can take it away now.
I had a guy in prison, he had Hep C, and I started an IV on him. And, you know, I was kind of dumb for doing it, but like, I just wanted to see if I could, so I started at 14 of them. And that Sunday started spraying, and it got all over me. And like, immediately I was like, damn, he's got Hep C. And they made me go through all kinds of tests.
Oh, yeah.
I was like, I regret it doing 14, but it was pretty cool.
Alright, so, TB, tuberculosis. Remember, airborne, what did we learn about airborne droplet transmission from COVID? Where's it gonna spread? Everywhere.
6 feet apart.
You got a what? 6 feet apart, 3 feet apart, stuff like that, because it's airborne, so it can get You want, that's why everybody was spread out, all this other stuff. So, where do you think airborne and droplet stuff transmits the easiest?
Nursing home. Hospital.
Places where people come together.
Large crowd.
Schools, jails. That's why TB gets in the homeless population, in the jail population. Because where do homeless people typically sometimes gather at night in the bigger cities?
Bridge.
No. That's a ventilated area.
Homeless shelter.
Homeless shelters. That's how it gets passed. You know why all y'all had to get a meningitis vaccine, didn't you? You know why?
Meningitis.
Because a kid died at Texas A&M, and his dad put forth this big deal. It's like, hey, there's a vaccination out there, but he caught meningitis in the dorm, in an enclosed environment, people gather. We had a TB outbreak in Ennis, and everybody had to go get pills. By the way, that little Mantal shot you get, that just checks for exposure. That's not a vaccine to TB. We don't have a TB vaccine. All right, but then you saw like people, like I went to one of the World Series games during COVID. It was nice. There was only 10,000 people in there. We were all spread apart, and I was like, this is the most comfortable I've ever been at a Rangers game or at the stadium. All right, but airborne droplet, you know, it's just like anything. Where it spreads through the school. You know, get a respiratory virus, that's where the pediatric doctor starts seeing all the kids. All right, but it spreads because they're at school and where they gather up. All right, we did the HEPs. What about meningitis? Or did I already say TB? Let's do TB. TB. Coughing up blood. Hemoptysis.
Night sweats.
Fever. Night sweats. Pale.
Sway.
It's airborne. So just remember, those 3 H's are the bloodbornes. So if they ask you about something you don't know, like measles, mumps, rubella, and you can't remember that shit, just know it's probably, if you're going to roll the dice, I'd roll the dice on the airborne. Alright? If they ask you how it's passed. Fever, night sweats, hemoptysis, bloody cough. If you've ever watched Tombstone, this is Doc Holliday. He used to be called consumption. Alright? He died of consumption, which was TB. It's a long deal. Alright? Sorry, I didn't mean to do that. I'll put that over there. Alright, meningitis. What is that?
Airborne.
Swelling of the meninges, right? So, it is airborne. Droplet transmission. Give me adult signs and symptoms.
Stiff neck.
Fever. What's the medical terminology for stiff neck? Nuchal rigidity. Nuchal, neck, rigidity, stiffness. Fever, nuchal rigidity. Headache. What's photophobia?
Brightness.
Sensitive to light.
They want to be in the dark. Sensitivity to light. Could they end up with ICP?
Yes.
And ultraviolet status? Yes. It's real bad. It can be bacterial or viral. Now, tell me about a kid that can't tell you signs and symptoms. Like a baby. Fever. Bulging fontanelle. Fever.
And something about their feet.
Oh, okay, I'll do that here in a minute. The fever, bulging fontanelle. They could have the nausea, vomiting, projectile vomiting. If there's ICP, they could be projectile vomiting. Unconsolable, like crying. That's their way of telling you their head hurts. Now, they can do a test. One of 2 tests. It does the same thing. You lay somebody flat, especially like an adult. If you raise their legs and their head comes up, that's a positive test. It's positive. It starts with a B. It's named after some dude. I don't want to say it's Babinski is a reflex. It's a test they do for meningitis. Now, the reverse of it, if You lay them down, you put their head up and their knees come up, that's a positive sign for meningitis. I swear it starts with B. Koenig sign, yes. Koenig sign. Same thing, reverse. Like that. Alright. Here's just something to remember. Do you know what the immunoglobulin responsible for anaphylaxis is?
E.
IgE. Do you know how to remember that? It's immunoglobulin E. It's the immunoglobulin responsible for anaphylaxis. It's IgE. How you're going to remember that is I give Epi. IgE. Just something to remember. That's the one they usually ask about. Alright. If they say something about if you're giving a blood transfusion or you're giving let's even say you're giving fluids, and basically your body starts having a reaction to it. It could be back pain. If they say pyrogenic reaction, I don't care what the reaction is. You can tell you started an IV and now they're paying their back, they're running a fever. It's usually with the blood transfusion. It says, what do you do? Stop the blood transfusion. That's it. It's just a question that sometimes confuses people. Alright. Alright. Sickle cell. Signs and symptoms. What would be the most obvious? How are they going to start it out?
Pain.
Nope.
Fever.
Nope.
You could-
Say that again?
Demographic, African American.
African American. We're going to have to give you that. Alright? Now, get to the signs and symptoms.
Painful.
Joint pain, chest pain, could also get a priapism, which is what? Erection. Alright. Low sats.
Would it be different saturations on like if you read different hands?
Could be low 90s, could be high 80s. I don't know if it will give you on different fingers or whatever. Definitely could have some shortness of breath or something, respiratory. Your big deal is fluids, morphine, and oxygen. That's your biggest treatment. And the other big thing to know is if they have a fever, it's called sickle cell crisis, and the danger is splenic rupture. Up there. Believe it or not, they don't have a lot of diabetes on there, which is stupid because
There's a lot of diabetic patients.
yeah, it affects like 80% of our patient population. And I don't know why they don't. Alright, but they don't have a lot of diabetes on there, except the big deal, they might have you hypoglycemic, but,
I found a couple of DKA questions.
huh?
I found a couple of DKA questions.
So DKA is about the only thing they really ask you
Yeah.
about. DKA affects what? One type of diabetic patient. It's always type 1. So the other one's the HHNK. Now there is a scenario question that I'll give you the answers to on the deal. I'll send you everybody the pictures, but It asked some patho questions, but I got them all labeled pretty good. But they stopped producing insulin, right? And we went through the whole, like, breaking down acidosis and stuff like that. All right. Adrenal gland, thyroid. You know what we're separating here? What's your thyroid disorders?
Hashimoto.
So hyper and hypo, those are the big ones. That's the two big areas. What's a hyperthyroid condition?
They're like really hot. They lose a lot of weight, I think.
What's the worst version of it? So,
Thyroid storm?
what?
Yeah,
Yes. Thyroid storm or thyroid toxicosis. Pretty the same thing. All right. So thyroid controls metabolism and heat production. So what do you think would happen if you found somebody that's hyperthyroid? I always say hyperthyroid is hot and skinny. So usually they run a little, like they may run at 100 or 99 something on the temp, and they may run a heart rate of like 90 something. Your two big hyperthyroid ones are Graves' disease and thyroid toxicosis or thyroid storm. I wish my sister-in-law could come over here. She's like a couple miles away. She had thyroid toxicosis or thyroid storm. So here's the thyroid storm that happens. This can produce tachycardic, and I'm talking about it can give you arrhythmia. So it can give you a tachycardic, like up above 150. It can actually put you into AFib. Their temp can get above like 107. It can get up to like 107. I think hers was 107. So AFib, temp over 107, they actually get hyper, I can't remember if it's hypotensive. I think hypotensive, so I think it's hypertensive. But she felt like she was going out of her mind. Picture somebody cranking your heart rate up, cranking your blood pressure up, and cranking your temperature up. She was just going out of her mind. Metabolism is going crazy high. The only way to fix it, medically, is to kill the thyroid. That's what she had done. They actually did iodine zeal. But for you, it's going to be treating the signs and symptoms. All right. So, what can you do? You can at least treat.
Cooling down.
You can treat all three of those signs.
Cool them down.
Cool them down.
Even something for the nausea and vomiting.
She didn't have any nausea or vomiting. You can give an IV. Can you treat AFib?
Ditalazam.
Can you treat hyperthermia?
Mhm.
Can you treat hypertension?
Yes.
So, labetalol, cardizem, and then try to cool them down. But they'll probably just want you to recognize them.
Google says wide pulse pressure is systolic hypertension.
Yeah. I always want to think they're hypotensive, but they're hypertensive. So like it can actually reach like what you would assume to be like stroke levels. I can get up in the 200s. All right, Graves' disease. Graves' disease has a couple of specific ones, but they actually have a commercial to treat. They call it thyroid eye disorder.
Why? Because their eyes bulging.
Protruding eyeballs. The other way would be bullfrog eyes, but they're going to say protruding eyeballs. It's where their eyes grow. It's like the deal, like a tissue or something. It folds. They grow a little bit away from their sockets. I've known two people with it. But you can't tell when somebody probably has it. Like big old bullfrog eyes. Had a guy at our station. He had it. He did not know he was losing weight. Again, he was not a fat guy, but he was just losing weight, unexplained. And then he had He thought normal heart rate was like 96 because that's what he's been all his life. And he thought some people just ran a little hot. And he said he always had a temperature of like 99.8, you know what I mean, when he wasn't sick, just normal sitting there. Now, again, the thyroid's kicking up, metabolism's up, heart rate's up, all the other good stuff, but they're going to give you protruding eyeballs. The other one is you can have goiter. So what happens is you got 4 thyroid deals like T1, T2, T3, T4 that secrete, and like when one gets clogged or one overproduces, that's when you get a goiter and swelling right here. So goiter just be oversecretion of thyroid hormone by one of your thyroid hormones. But they're going to give you the bullfrog eyes. All right, hypothyroid. There are a couple of them. I'm going to give you the one that they ask on me every time, and they've asked other people. So if you're hypothyroid, what do you think those people take for medication? Oh, that's one of the medication ones. They have to take thyroid supplements, right? You know what the 2 most common are? Synthroid, because it has throid in it, and the other one has thyro in it, levothyroxine. So if they take levothyroxine or Synthroid, they are hypothyroid. So these are your fat and cold.
The moon phase.
Huh?
I heard it's called moon phase.
Nope. This is where people start mixing up adrenal gland and thyroid disorders. Alright?
What was the first one? Medication?
Synthroid. Synthroid. They see endocrinologists that gets prescribed Synthroid, and it's like they'll start them off with 75 mics, and then they'll just like, hey, it's not working. They'll increase it to 90, 95, and they'll play with their levels, just like testosterone, any kind of replacement therapy. All right. So here's 2 ways this issue could happen. You have you're not taking the undiagnosed hypothyroid. The worst version is called myxedema coma. In the name is coma. So what do you think they get?
Coma.
Cold, ultra-mental status. They're cold and ultra-mental status. So it could be like 92 degrees, 93 degrees, body temp, and ultra-mental status. They didn't know they had hypothyroid. They stopped secreting thyroid hormones. All right. Now, the other way you could get it, if you abruptly stop taking your thyroid medication. You've been diagnosed with hypothyroid, and you stop taking it, and guess what? Your body doesn't have time to correct and start producing some. So if you abruptly stop taking hypothyroid medication, you could end up with myxedema coma. The 2 myxedema coma questions, it's diagnosing, and the other one was a respiratory deal. They were ultra-mental status, so I started ventilating. And they were breathing like 6 times a minute. Remember, thyroid, metabolism, heat production. Your other one they get confused is adrenal gland. What does your adrenal gland secrete? Adrenaline and corticosteroids. So, if you're hypoadrenal, you have to take corticosteroids the rest of your life. It's like Medrol, it's like Cortef.
Is it hypo or hyper?
Hypo. If you're low on it, you have to take supplements. Now, your adrenal gland, where does it sit? You ever seen a strawberry? You ever seen the green thing on top? It's like that on your kidneys. It sits right on top of your kidneys. Or like an eggplant. No, like an eggplant emoji. An eggplant. You get the green deal on top, that's where it sits, right on top. Alright? Hypoadrenal is called Addison's disease. Your 2 big key signs or symptoms, they're going to be hypotensive, but they're also gonna give you a, God dang, what's the skin? Hyperpigmentation of your skin. It's almost like a coin or copper kind of look. Can't explain it, but if you could find color TV pictures or color pictures of JFK, he had Addison's disease. Just kind of like a little glow or tan or whatever, but he had Addison's disease. But they'll give you hyperpigmentation of the skin. So that is low corticosteroids. And you have to take corticosteroids your whole life. Now, I told you that whenever you take corticosteroids, it can make you swell up. Especially you can see it like with chronic bronchitis or like respiratory patients that take a lot of steroids, they get puffy, thin skin in the face. It makes you gain weight. Alright? So if you're hyperadrenal, it's an overproduction of corticosteroids. This is where they get moon face. It's thin skin, water weight, and they get swelling in the face. They get moon face. It can also cause hair loss. They can also get a buffalo hump in their back. You ever seen that? Like a little fatty area up there in their back, kind of makes their head protrude forward. I wish, like 3 secretaries ago, we had a girl with it here. She had it a whole lot, but she has, this is called Cushing's disease. So they get moon face, hair loss, buffalo hump, and it's just the oversecretion of corticosteroids. Those are the 4 main things you need to know. So corticosteroids, too much, Cushing's. Not enough, Addison's. You good with that? It's nothing to do with the thyroid. It's the adrenal gland. Alright? Alright. Stroke, I would like to say they ask you a lot on stroke. What are your 2 types of strokes?
Hemorrhagic.
So TIA is a good one to ask. TIA is like your what do you have leading up to somebody that's having a heart attack? Angina.
Mm-hmm.
It's like a precursor to a stroke. A TIA is stroke-like symptoms that resolve 24 hours. Mini stroke. And you're probably setting yourself up to have a big stroke. Yeah.
I treat it like a stroke.
Yeah, treat it like a stroke every time because you don't see it resolve. Alright? Now, you have ischemic strokes and hemorrhagic strokes. 85% of strokes are ischemic. It could be a vasospasm, it could be a clot, it could be a vein collapse, but it's an ischemic stroke. This is the one, these patients they don't have to be hypertensive. Like they're not ICP. So, ischemic stroke is, think of all your stroke tests. So, hemiparalysis, one-sided, yes. So that gives you the facial droop, the arm drift, the garbled speech, all your Cincinnati stroke scale, this is ischemic stroke. They can have a blood pressure of 120 over 80 and have an ischemic stroke. Alright? What's one of our key things to figure out for stroke?
When it happens.
Last known normal. Last known normal is key. And you always want to tilt them to their affected side, so that way you don't have to suction. It won't become an airway issue. Hemorrhagic stroke. You can have a brain bleed from trauma. You can have a brain bleed from an aneurysm rupture. Alright? There's 3 key brain bleeds that you need to key in on. One is an epidural bleed. An epidural bleed could be a sudden loss of consciousness and then followed by a moment of lucidity. What does lucid mean?
You're not
Lucid
there.
is aware. You know, like you're just like us here. You're aware of what's going on. So they get knocked out, then they come back and have their moment of lucidity. But an epidural bleed is a arterial bleed. So you get fast onset ICP. So if they say the patient hit their head 30 minutes ago and now they're showing signs of ICP, posturing or something like that, they say, what kind of bleed is it? It's an epidural bleed. Your subdural bleed, most time you get patients with subdural bleeds, they just get monitored, right? And they're going to be monitored for any kind of brain shift or any kind of ICP. But a subdural bleed is a slow bleed because it's a venous bleed. It might show ICP within 12 to 24 hours, and you might get no ICP. But if they give you ICP vitals and they say it happened yesterday, it's a subdural bleed. But it's a venous bleed. Your last one is more medical. It's called subarachnoid hemorrhage. Alright? So a subarachnoid bleed has a very distinct key sign or symptom.
Headache.
Sudden onset thunderclap headache. Worst headache they've ever had. You go in there, you go into urgent care and say, all of a sudden I had the worst headache you ever had, they're going to call 911 faster than you can shake a stick. Because that's a big sign or symptom of a subarachnoid bleed. I've only talked to one subarachnoid bleed. Here's what happens. You get a real bad headache, worst you ever had, you go in a dark room, you take some Advil, you take some Tylenol, and then 3 hours later they're like, hey, where's so-and-so? They go wake them up and they can't wake them up.
Wasn't that like Liam Neeson's wife or what was her name?
I don't know. I know she was an
Actress, and she was on a ski trip, and then she had skiing or something, and went to go lay down while they went to go drink or something, and came back and she was dead.
Huh.
I think it's Liam Neeson.
Yeah.
I don't remember.
She probably could have had an epidural, subdural bleed.
Yeah.
But usually a subarachnoid, I'm not saying it can't be trauma-induced, it can. But if it's medical, like no trauma-induced, it's sudden onset, worst headache you ever had.
Oh, she had epidural. Never mind.
Fast onset ICP, like within an hour or two, because it's arterial bleed. Alright, the subarachnoid, worst headache you ever had, thunderclap headache, they have to give you that. Subarachnoid. Epidural, arterial, fast onset ICP. Subarachnoid, worst headache you ever had, thunderclap. Subdural, could be, I know people with subdural bleeds that never go past anything. You know? Subdural bleeds are like what they watch out for with falls with blood thinners. Alright? I'll be honest with you, seizure shit, they don't hit you a lot on that either. We don't deal with a lot of seizures, like because it's very rare to catch them in the middle of seizure. We come to the post-typical phase. So, your biggest deal on a seizure is how would you know they're going to be altered mental status? What would make you think they had a seizure prior to your arrival? But what does post-typical look like?
They piss their pants.
Combative.
What are they going to say medically on it? Urinary incontinence. So if they say incontinent of urine, that's a sign that they might have had a seizure. Alright? If they have maybe a little blood from the mouth,
Bit their tongue bleed.
bit their tongue or bit their mouth, chewed up on their lip. Alright? What do you think their look like heart rate, blood pressure? Tachy, fast respiratory rate, unresponsive. There's a good chance they had a seizure. Do we treat seizures after they happen?
No.
Treat them while they happen. Now, what do we give seizures if they start seizing in front of us? Benzo. There's only two seizures that you really treat differently, and that's a febrile and a clamsy seizure. Clamsy seizure, you give
Just
what?
mag.
And
benzo.
And the benzo. And then if it's a febrile seizure,
You calm them down first.
you get to cool them down. They can have a febrile seizure up to 30 minutes. So work on cooling them down first. Can you give benzos
Yes.
for the seizure activity? Yeah. But your primary deal is to get them cooled down first. And if they keep seizing, then give them the benzo. Petite mal, grand mal. Grand mal is the big herkin jerkin, tonic clonic movement. Petite mal just means petite, grand, big, petite, small. That could be the absent seizures, that could be little movement, all this other stuff. If they ask like, hey, they're just having little circulations, whatever, that's a petite mal. Common treatment for said Valium. Can you give it rectally?
Yes.
We used to give Valium rectally for pediatric seizures. You know what? It works pretty quick. A lot of absorption down there. Alright, that's the bloodstream. Alright, last, cranial nerves. I don't go crazy on cranial nerves. I give you what I've experienced and what other people have come back with. If you want to review cranial nerves and go deep diving on your own, go for it. So you got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, I think it's 12 cranial nerves. Alright, so I'll go over the ones that I know, or they said something. 3, what is your 3?
Eye movement.
Ocular, what's it? Somebody pull them up so we'll have them listed. Ocular motor,
Nerve.
This is the small first one.
yeah, I know olfactory. Olfactory is
Ocular motor.
so olfactory is smell. You can say, hey, one nose. 2, optic nerve. That does not control pupil constriction. So I usually draw a face here. So
Like fishing.
alright, keep going.
Ocular motors. Third.
What is it?
Ocular motor.
Yeah.
And the biggest deal with that is, what you need to know is that's what causes, controls pupil constriction. Four.
So it's downward and inward eye movement.
Remember where that is on the picture. Alright. Trigeminal.
Facial sensation and tree muscles.
So you remember that with trident gum? Trigeminal neuralgia is pain in the jaw from chewing. Trigeminal neuralgia. Abducens?
Yeah.
What you got there?
Outward eye movement.
Alright.
Then next one's facial. So like taste, facial expressions, and saliva and teeth expression. It looks pretty good.
Bell's palsy,
Well, what?
7. So if they ask you about Bell's palsy, it's stroke face, but no stroke body. And they have, what'd you say about the tear production?
It's tear and saliva expression.
So they actually have to, he goes, Dad, you have to take their eyes shut. Or they wear a patch. Yeah. What about 8? Vestibular,
Vestibular fovea.
what do you think that has to deal with?
Ears, the ears.
How do you know that?
They're clear, the whole clear.
Cochlear. So it's something with the ears, right?
Yeah.
What about 9?
The next one is glossopharyngeal. That's for swallowing, gag reflex, speech, and taste. And it's the back of the tongue.
Alright.
And then the next one is
Vegas. We don't all know what the vagus nerve does. Slows your heart rate down. Alright, 11.
accessory. Accessory, color, working muscles.
12.
Epiglottal, where the tongue moves your teeth and swallow.
If I was gonna know something, I'd know those.
And 11 is for swap, like tongue movement and feet.
So, IE test 9 and 11. Stick your tongue out, and then refer back to me, or repeat back to me. New dog can treat old, can't teach an old dog new tricks. There you go. But they can't remember how to say it. Alright. Now it's all up to y'all. So who's going tomorrow? Hey, does everybody have a number? Remember it? 214-543-0762? Oh, hold on, real quick. I'm gonna share it with somebody who's got their, and y'all share it with, collections. Alright. Alright.
Are you able to airdrop it?
So I'm gonna do it right now. Send it to Jose. Some of it's just my review stuff. The other part are just straight up scenario questions. I labeled them en route, scene, and post scene. So it should be airdrop that to Jose right now.
Did you see mine pop up?
Huh?
Did you see mine pop up for that? For
Not yet.
80? Or just turn it on?
Did you get it? Same
Yes.
way. All right. Caroline's